Hello friends, welcome to Forensic Medicine by Dr. Paras, and now we are going to talk about chapter number 3, that is Toxicology part 3, my dear friends. And now we are going to talk about the new topic called as metallic poisons. The compound of metals are poisonous. Not all the part of metals are poisonous, but the compounds of the metal are poisonous, my dear friends. In this, we need to learn first about the arsenic poisoning, my dear friend. Before arsenic poisoning, just add one more topic right here, sir. Just add one more topic right here, sir. That is your cadmium poisoning. Cadmium poisoning. Now, what happens? What the cadmiums do? Cadmiums replace the calcium from the bone. This will lead to softening of the bone, and this will lead to pathological fracture. Now, how you will treat such condition? You will remove the exposure. Remove the exposure. Done, sir? So this is all about the cadmium poisoning. Cadmium poisoning, what is happening? Cadmium has a specific property that it will replace calcium from the bone. Moment you will see, this is a bone. If I draw a bone like this, if a calcium got replaced and cadmium is coming, then that is making bone. Without calcium, bone will not be hard. Bone is not hard, bone will be soft. So easy fracturable situation will come and the bone will break down easily. Pathological fracture can happen in the cadmium poisoning. How you can treat? You can simply just remove the exposure. Just simply remove the exposure and case will be done. Now we will be talking about the next poison, that is arsenic poison. If we talk about the arsenic poison, first of all, arsenic mimics the disease called as cholera. Arsenic poisoning mimics the disease called as cholera, my dear friends. And if we talk about types of arsenic poisoning, number one is fulminant type, another is gastroenteritis type. Gastroenteritis types are something which are mimicking the cholera, and there will be a rice watery stool. Cholera, Vibrio cholerae is the organism, but here in case of arsenic poisoning, arsenic is the poison which is responsible for the rice watery stool, and this rice watery stool will resemble the cholera. That is why it mimics the cholera. It is said this poison mimics the cholera. Fulminant type, peripheral vascular failure will happen. What is happening? Peripheral vascular failure will happen. And now if peripheral vessels will fail, my dear friends, the blood will not be supplied to the end organs, and if the peripheries will not get the blood, they will go under necrosis. Might be there will be a gangrene in the later stages and you have to amputate the limb, my dear friends. So these are the two types, fulminant type and the gastroenteritis type. Other things we talk about the clinical features. So clinical feature number one, if we talk about right here, sir, Eldridge-Mee lines are there. You can see right here, sir, the white lines on the nail. The white lines on the nail is Eldridge-Mee's line. The white line on the nail is what, sir? Eldridge-Mee line. Now, if you check the mucosa, the special property about the mucosa is red velvety mucosa. Red velvety mucosa, and this is because of, red velvety mucosa, this is because of hemorrhagic gastritis. Hemorrhagic gastritis. Plus on the pigment on the skin you are going to see the raindrop pigmentation like this, dot, like the rain. So raindrop pigmentation can be seen. Now excessive hyperkeratosis of the palm and soles, you are going to see what, sir? Excessive hyperkeratosis. What you are going to see, sir? Excessive hyperkeratosis of the palm and sole. And this excessive hyperkeratosis, deposition of more keratin, will make skin more prone to get a disease called as what, sir? Your basal cell carcinoma or squamous cell carcinoma. So these conditions can happen. Basal cell carcinoma, squamous cell carcinoma. A special property about the basal cell carcinoma, special property is, this is malignancy which do not metastasize. The malignancy which do not metastasize would be your basal cell carcinoma. Would be what, sir? Your basal cell carcinoma. This is the best example. How it can happen in the arsenic. There is excessive hyperkeratosis, and excessive hyperkeratosis of the palm and sole would lead to such condition. Then, sir, there will be a peripheral neuropathy. Peripheral neuropathy, you will see something. The sensory sensory control is lost first, then motor will be gone. So in the arsenic, first sensory is gone, then motor. The moment you are touching the skin of the patient, he is or she is not able to feel anything. Then followed by the motor one. Then followed by the motor one. Then, sir, it mimics the cholera. Why it is mimicking? We say it is mimicking the cholera because there is a rice watery stool. Because there is what's a rice watery stool. Plus there will be a golden hair, like garlic is having golden color of hairs. Same in this patient, you are going to see the golden hair. The hairs will turn now golden. Now, the smell is important of arsenic. The smell is garlicky smell, my dear friends. The smell would be garlicky smell, and there will be a black foot disease. How this black foot disease is developing? There is a thrombosis. Mechanism of action says there is a thrombosis. Thrombosis of the peripheral vessels. Peripheral vessel. There is a thrombosis of a peripheral vessels which will decrease the blood supply. And in the end, there will be gangrene. There will be gangrene. So black foot disease, see this written over here also. Thrombosis of peripheral vessels you are going to see. Because of the thrombosis of the peripheral vessels, my dear friends, there is a gangrene. How you will treat the arsenic metal poisoning, my dear friends? First of all, there will be an antidote, and the antidote is ball. The antidote what we are using is, sir, ball plus gastric lavage and ferric oxide we are using. So ferric oxide is the antidote we are using, but the chelating agent what we are using is a ball. British anti-leucide we are using. So arsenic, you will understand gastric lavage. Yes, we'll do. How to do the gastric lavage? With the help of evolved tube. And ferric oxide we can give as an antidote in arsenic. But if someone asks you chelating agent we use, specifically your answer will be BAL. British anti-leucide. Now next poisoning we want to discuss, plus investigation if we talk about, investigation. Sir, urine sample to check. Urine sample will take, to check the presence of arsenic metal, my dear friends. Now the chelating agent, what they do, they will actually do what? They convert insoluble form of metal into the soluble form. Insoluble form of the metal would be converted into soluble form. That is the primary work of your chelating agent, and here chelating agent is ball, my dear friends. Now coming to the next, that is mercury. Next metal we are going to study is mercury. Mercury is also called as quicksilver, which is seen in the liquid form. Quicksilver, which is seen in the liquid form, is quicksilver. You will see it will be in a liquid form. Mercury you have seen in the thermometers. Thermometer. Fatal dose is 1 to 2 gram. How much fatal dose is there? 1 to 2 gram. Now there is a Donovan solution. What is Donovan solution? Sir, there is a mixture of arsenic and mercury compounds. Because as I told you, whole of the mercury is not toxic. Only the compounds are toxic. Whole of the arsenic is not toxic. Only their compounds are toxic. So here we are mixing the two toxic things, arsenic and mercury compound. And they can be used for the treatment of STDs. STDs. For example, herpes simplex virus. STDs. Now my dear friends, Donovan solution is having the clinical importance. Remember, arsenic and mercury mixed together, AM mixed together to treat STD. To treat STD. Now poisonous form of mercury. Sir, the poisonous form of mercury, organic more common than the mercuric. Organic, then mercuric, then mercurous. In all of three, which one is most common? I repeat, mercuric is most common. Mercuric is most common. Most poisonous is organic. Most poisonous is organic. But if someone asks you most common form of mercury, then sir, it is your poisonous. It is your mercuric. Now acute mercury poisoning. If there is acute mercury poisoning, the patient will be coming to you with the breathing difficulty. Diphtheria-like membranous colitis. What is happening in the diphtheria? Sir, first of all, there will be a pseudomembrane. Pseudomembrane per oral, which bleed on touch, on removing, and this bleeding is pinpoint hemorrhage. This bleeding is pinpoint hemorrhage. Diphtheria-like membranous. Plus in diphtheria, one more symptom is there. Bull's neck. Bull's neck will be there. Bull's neck will be there. Plus there will be pain. So three things are there, sir. One is breathing difficulty, another is diphtheria-like membranous colitis, which is a pseudomembrane, white color, which is white in color. I would love to write here, sir. Pseudomembrane. Nature of this would be white in color. Then sir, chronic mercury poisoning. Number one thing is you are going to see acute wala ka sign and symptom. If you see the acute sign and symptom would be your breathing difficulty, would be your diphtheria-like colitis, would be your pain. These are the important which are seen in the acute, means suddenly you are going to see. Chronic mercury poisoning, if you are going to see mercurial lentis. So what is happening in mercurial lentis? There is a mercury deposition in the anterior lens capsule. Mercury deposition in the anterior lens capsule. So what is happening? There is a capsule in the eye. In this capsule, there is a lens. This is capsule. This is capsule and this is lens. Now in this capsule, what will happen? The green color mercury will be deposited just anterior to the capsule. If mercury will be deposited, the person will not be able to see anything. Will not be able to see anything. The mercury deposited in the anterior lens capsule, my dear friends. Now, other symptoms you can see, gingivostomatitis. Gingivostomatitis, guys, inflammation of the gum and the lips are seen. You will see the gums and the lips are inflamed. Inflammation is there. This is also seen in vitamin B2 deficiency. Riboflavin deficiency also present with this chiliosis-like features. The inflammation of gums and the lips. Now, other thing can be associated with this would be the tremors. And the tremor name is Danbury tremor. Danbury trimmer is a hand trimmer. Person find difficulty in writing. Like I am writing, my hands will be like this. If a person is finding difficulty in writing, the hand trimmers, these special kind of trimmers are seen in chronic mercury poisoning. This is Danbury trimmer, Danbury tumor, Danbury tumor. Now hatter's shake or glass blower shake. Hatter's or glass blower shake. You are holding some glass and your hands are moving like this. This is called as hatter's shake or glass blower shake. Hatter's shake or glass blower shake. Then coming to the erytherism. In erytherism, what will happen? These are happening in the chronic mercury poisoning. The person feels shy. Person feel shy. There will be anxiety in the erytherism. There will be depression. There is loss of confidence and person will be irritability will be increased. Hyper aroused would be there. Irritability will be increased. So erytherism, what will happen? The person will feel shy, anxiety, depression is there, lack of confidence is there, because the mind, the brain is also affected in the mercury poisoning. Another thing is acrodynia. Acrodynia is most commonly seen in the children. Acrodynia is most commonly seen in the children. It is also known as pink disease or swift disease. Acrodynia seen in the children, pink or swift disease. Limbs become pink, painful and puffy. Limbs will become pink, painful and puffy. They will look beautiful, pink, pale and puffy. Seen in the children, also known as pink disease or swift disease. Limbs become pink, puffy. Now sir, treatment part if we talk about, first thing is gastral lavage. Yes, chelating agent now is BAL. What chelating agent do? We have discussed. Chelating will convert the insoluble form of mercury into soluble form. If it becomes soluble, it will be excreted out from the urine. Also we can use chemical antidote, and chemical antidote what we are using here sir, sodium formaldehyde sulfoxide. Sodium formaldehyde sulfoxidase. So here we are having mercury. In mercury we have seen the Donovan solution. Donovan solution, arsenic and mercury compounds are mixed together. When arsenic and mercury compounds are mixed together, they are used for the treatment of STDs. Then there will be a poisonous form of mercury, organic, then mercuric and mercurous. Most common form is mercurous. Most poisonous form is organic mercury. Acute mercury poisoning, breathing difficulty can be seen. Diphtheria like membrane colitis can be seen. Then pain can be seen. Chronic mercury poisoning, if we talk about mercurial lentis, there is a deposition of mercury in the anterior capsule of the lens. Then gingivostomatitis, inflammation of gums and lips you can see. Tremors, if we talk about, the person will feel difficulty in writing, that is called as Danbury tremor, my dear friends. Then coming to the hatter's shake or glass blower shake. Then there will be erytherism. The person, these are related to the CNS. The person will feel shy, person will be depressed, irritated, self-confidence will be gone. Then acrodynia, which is seen in children, which is also called as swift disease or pink disease. What is happening? The limbs become more pink, painful and puffy. PP, 3 P's remember. These are the 3 P's you need to remember here sir. PPP. Acrodynia is triple P, that is pink, painful, puffy. Pink, painful and puffy. Now treatment we have learned, gastric lavage, yes we can do. Metal chelating agent, we can use BAL. Chemical antidote for the mercury poisoning is sodium formaldehyde sulfoxylate. Sodium formaldehyde sulfoxylate. So we are done with the mercury also. Now the next poisoning which we need to see sir right here sir is what sir? Your lead. Sir, lead, if we talk about the common salt, the common lead salt is lead tetroxide, and lead carbonate and tetraethyl lead. Guys, the lead tetroxide, the lead tetraoxide, remember it is used in sindoor, which is also called as vermilion. Then lead carbonate is used in the paint. and tetraethyl lead is used in the petrol. One more is there, sir. Lead sulfide. Lead sulfide is used in the eyeliner. It is used in the eyeliner. Lead sulfides are used in the eyeliner. So 4 we are having. Lead sulfide, eyeliner, lead tetroxide, sindoor, which is also called as vermilion. Then lead carbonate in paint. Then tetraethyl lead, that is in petrol. Now sir, acute and chronic poisoning. If we talk about acute and chronic lead poisoning. Acute lead poisoning cause throat pain, nausea, vomiting, dyspnea. With mercury also dyspnea-like feature were there. With the lead also dyspnea-like features are there if it is acute poisoning, my dear friends. So there will be a throat pain, there will be nausea, there will be vomiting, there will be dyspnea. Plus, if I talk about the chronic poisoning features, what are the chronic poisoning features? You will see microcytic hypochromic anemia. Microcytic hypochromic anemia. Microcytic hypochromic anemia. Pale RBC, you will find pale RBC. Microcytic, small pale RBC. Sir, other can be amenorrhea. Amenorrhea is absence of menses. Absence of meniscus. Absence of meniscus. Plus blue lines on the gums. The blue lines on the gum is called as Bertollian line. You can see very well here, sir. Lead poisoning. You are going to see what's that? Bertollian line. Bertollian line. This is Bertollian line. Plus on RBC, what you are going to see, sir? Blue dots in RBC, which is called as basophilic stippling. You see, this is normal RBC. This is abnormal RBC. Basophilic stippling is seen with the lead. Now there will be constipation. In the lead toxicity, the patient will be presenting you with the constipation. Plus there is a wrist drop and foot drop. Why there is a wrist drop and why there is a foot drop? If we talk about the foot drop, my dear friends, the foot drop is because of involvement of common perennial nerve. Common perennial nerve. And sir, wrist drop is due to involvement of radial nerve. Radial nerve. This radial nerve, wrist drop can also be seen with the radial nerve injury when there is a shaft of humerus fracture. But this we are talking about the toxicity. The lead toxicity is what you can be presenting with. So all this Bertollian line important, constipation, then there will be a basophilic stippling is important, then wrist drop and foot drop would be very common right here, sir. So we are done with this. Now, sir, if we talk about the treatment, ball we can use with what, sir? DMSA. DMSA stands for dimercaptosuccinic acid, or we can use it with the EDTA. Combo we have to use ethylene diamine tetraacetic acid. Plus other thing, now you will see the diagnosis in the blood. Diagnosis part in the blood. If you diagnose in the blood, you will see there will be increased lead level. Increased lead level in the blood, my dear friends. Other than that, there will be increased free porphyrin. Plus on X-ray, you will see the lead line. So this is sufficient information to solve any question on lead toxicity, my dear friends. Now we'll be talking about the next is copper. So copper poisoning, there are the two poisonous compounds are there in the copper. So my dear friends, two important compounds which are there in the copper, if you see here, copper sulfate and copper subacetate. Copper sulfate, subacetate. Clinical features will along what, sir? Clapton lines on the glove. There are blue-green line. Bertollian line is blue line. If it is blue-green line, we call that as Clapton line. One is blue, another is green line on the gum. Blue and green line is called as what, sir? Here, Clapton line. And vomiting is also blue-green in this. In the copper poisoning, guys, remember, The vomiting is also, what sir, your blue and green vomiting is there. Blue-green vomiting is there. Blue-green vomiting is there. Chalosis can be seen. What is chalosis? You can see deposition of copper tissue, deposition of copper in the tissue and skin, and this is blue-green line. Blue-green line, you can see this is kleptol. Blue-green line is kleptol line. Kleptol line. And chalosis is deposition of carbon in tissue and skin, my dear friends. Now we are coming to the Wilson's disease. Wilson disease also associated with this. What is happening in the Wilson disease? Wait, I'll show you. There is a copper deposition. There is a copper deposition in the different part of the eye. In the different part of the eye, if it is deposited in the eye, in different part of the body, if it deposited in the eye, then it will lead to formation of KF ring, Kescher-Fleischer's ring, Kescher-Fleischer ring. Actually, I'll tell you the mechanism right here in the Wilson disease, which is very, very important. Wilson disease, there is a deficiency. There is a deficiency of ceruloplasmin. There is a deficiency of ceruloplasmin, and ceruloplasmin is a copper transporter. So what will happen? The copper is not getting transported now due to deficiency of ceruloplasmin. Copper is not transported. When the copper is not transported, it will start settling in different part of body. If it is deposited on the eye, it will lead to formation of KF ring, Kescher-Fleischer ring, my dear friends. Plus one gene is involved in the Wilson's disease, that is ATP7B. ATP7B gene is involved. Gene is involved as ATP7B. Then ptylism. What is ptylism? Increased salivation is called as ptylism. That can also be seen right here, sir. Now, my dear friends, other than that, you will see blue-green discoloration of hair seen when swimming in a pool treated with the algacidal copper compound. Algacidal copper. To kill the algae, we use different compounds, and if we swim in that water, we will get the bluish-green discoloration of the hair, my dear friends. And this is something KF ring. You can see the copper deposition along the capsule. Copper deposition will be there, and this is KF ring, which is seen in the Wilson's disease. And Wilson disease is something which is associated with the copper poison. Copper, deposition of copper. So clinical significance also we have learned. Plus, if you talk about the treatment part, antidote is potassium ferrocyanide. And if chelating agent, then penicillamine. The chelating agent will be what, sir? Your penicillamine. Here we studied the copper, and I would love to tell you something about the iron also here in the same place, sir. You can write it down about the iron. If we talk about the iron poisoning, write it down, sir. Iron poisoning, iron. Iron poisoning. If you see iron poisoning, we are having 4 stages. 4 stages of iron poisoning. Stage 1, if we see, sir, what are the symptoms are there in the stage 1? Gastroenteric phase. Gastroenteric phase will be there. The gastroenteric phase will last less than 6 hours. Then we talk about the second stage, stage 2, that is asymptomatic. This is a stage of confusion. Asymptomatic. This is also called as stage of confusion. Why this is stage of confusion? Person came to you with the iron intake. He has given to history that Doctor, I have taken iron, this, that, and after that I got features like diarrhea, etc. And now it is stopped. Guys, what you will do as a doctor? You will wait and watch. For how many hours? 24 hours. Wait and watch for 24 hours. This is stage 2. Now stage 3 if we talk about, sir. Stage 3 is multi-organ involvement. Stage 3 is multi-organ involvement. Multi-organ involvement is there in the stage 3, my dear friends, and this will take how many days? 1 to 2 days. Now we talk about stage 4. Stage 4. Now what will happen? Bowel obstruction. Bowel obstruction. Bowel obstruction. Bowel obstruction. Bowel obstruction will be there, and this will be seen within 2 to 6 days. Now, sir, bowel obstruction is it. So how it is starting? See you beautifully. First of all, gastroenteritis. There will be diarrhea, etc. Then no symptoms. Then there will be multiple organ involvement will be there. Then after that, bowel obstruction will happen. After the involvement of the organs, organ will stop working, peristalsis, etc. will stop working, and then there will be bowel obstruction. Constipated person will be there. Now, how you will treat? Treatment having 2 things. One is antidote. We are having desferoxamine. And other treatment we can go for the hemodilution. Other treatment we can offer what, sir? Hemodilution. So we have the hemodilution. Now, my dear friends, next thing we are going to talk is what, sir? Thallium. So thallium is also called as ideal homicide poison. Thallium is also called as ideal homicide poison. So guys, remember there is a classical triad. This we have covered. Now classical triad of thallium. It is PAS. Classical triad is PAS. What is PAS? Painful peripheral neuropathy. There will be painful peripheral neuropathy, plus there will be a alopecia, loss of hair, alopecia, plus there will be a skin rash. So PAS, painful peripheral neuropathy, alopecia, skin rash, and antidote is Persian blue. This is stain also, but here in case of thallium poisoning, it is antidote. Okay. Now, also we can see other features like Eldritch-Mee line here. The skin rash mostly is butterfly-like. Plus one more feature we can see here is Eldritch-Mee line. In arsenic also we have seen Eldritch-Mee line, and here in the thallium also we see the Eldritch-Mee line, my dear friends. Antidote is Persian blue, plus we can add potassium chloride. KCl also we add in this, sir. Now we move on to the very next topic. This very next topic is what, sir? Your phosphorus. So 2 types of phosphorus are there. One is white phosphorus, another is red. Sir, this white phosphorus is toxic and red phosphorus is non-toxic. If we talk about the white phosphorus, remember white phosphorus is used to make the Diwali crackers, and red phosphorus, which is non-toxic, it is used at the site of matchbox. Now, the toxic one will have the smell and non-toxic one will not have the smell. So we talk here white phosphorus is toxic and fatal dose is 60 to 120 mg. And if we talk about the garlicky odor is garlicky in the white phosphorus. Garlic is also of a white color, so garlicky odor will be here, and it is kept in water and used to make the Diwali crackers. So who is used to make the Diwali crackers? Your answer is very simple, that is white phosphorus. And which is used at the site of matchbox? Your answer will be red phosphorus. Now acute poisoning, acute phosphorus poisoning, I am telling you. There will be a smoking stool syndrome. What is this smoking stool syndrome? Vomiting and stool are luminous. Wow! Moment you are vomiting, it is lightening up. The moment you are passing stool, the stool is glowing. Jugnu, like Jugnu, stool is glowing. Vomiting and stool are luminance. This is smoking stool syndrome, which is seen in acute phosphorus toxicity. Plus, there will be asterexis, flapping tremor of the hand. Asterexis, flapping tremor of the hand. Flapping tremor of the hand would be seen asterexis. So these are the symptoms which you are going to see with the acute poisoning, my dear friends. Acute poisoning, my dear friends. Then chronic phosphorus poisoning. In the chronic phosphorus poisoning, you will see the phossy jaw. And phossy jaw is happening because of the osteomyelitis of the mandible. And necrosis with the multiple cyanosis is there. If I can show you, there will be a phosphorus burn also. Phosphorus burn also. We can see right here, sir. Phossy jaw. This is phossy jaw. You can see there is a necrosis of mandible. There is necrosis of the mandible. And because of necrosis of the mandible, this will be the appearance. Plus, there will be a holes, pitting. There will be pitting. This is seen with the chronic one. Now, treatment of phosphorus burn, if you talk about, sir, or how you will treat such condition, phosphorus burn. Phosphorus burn, topical application of copper sulfate. First of all, we'll apply the copper sulfate right here. Then phosphorus burn, gastric lavage with potassium permanganate will give the vitamin K, do the peritoneal hemodialysis. We do the peritoneal hemodialysis, the peritoneal organs, peritoneal hemodialysis will do. So treatment in the phosphorus burn, we have to apply the copper sulfate, phosphorus poisoning, gastric lavage with the potassium permanganate plus vitamin K, plus you will give the peritoneal hemodialysis. Now we coming to the next, that is spinal cord poison. The next poisoning is strychnine poisoning. Spinal cord poisoning. In spinal cord poisoning, first one is strychnine. Strychnine poisoning will be also nux vomica, which mimics the tetanus. Which mimics the tetanus. So how is the mechanism of action? See what is happening. It's written here also, inhibit glycine by acting on anterior horn cell. So inhibit glycine by acting on the anterior horn cell. See what is happening. There is a anterior horn cells. If I draw here, sir, there will be anterior horn cells. This is anterior horn cells. Anterior horn cells are connected to the muscle. This is muscle. And in between this, there are the receptors which are also called as Renshaw cell. Renshaw cells, which is acting as an inhibitory. Renshaw cell. From Renshaw cells, the inhibitory signals are going to the anterior horn cell by the glycine. Glycine. And guys, what is happening? They are inhibiting the glycine. How they are acting? They are acting here. They are inhibiting the glycine. Inhibition of the glycine by acting on the anterior horn cell. The glycine is inhibited like this. Now coming to the other thing is seeds of strychnine. You can see very well, image base can be there. Seed of strychnine. Strychnine is also called as kulicha, not kulcha you eat, my dear friends. Kulicha nux vomica dog button. And guys, toxins are the crushed seeds. Not normally, these are not. If you crush them, then only they are toxic. So toxins are the crushed seed. Crushed seed. So see these dog buttons, when they block the glycine, what will happen? The signals will be blocked. So there will be uncontrolled muscle contraction. contraction. Uncontrolled muscle contraction will happen. Uncontrolled muscle contraction will happen. That is how it mimics the tetanus. Now, toxins are brucin. Toxins are brucin. Yes, the toxins are brucin and strychnine. Strychnine is most potent. Fatal dose is 1 crushed seed. 1 crushed seed is fatal. It mimics a disease called as tetanus. So, tetanus is also called as 8th day disease. Tetanus is also called as what, sir? 8th day disease. What is the clinical presentation? Asphyxia due to the respiratory muscle paralysis. So asphyxia is happening as the muscles are uncontrollably contracting, no relaxation is there, only contraction. What will happen? No space left for lungs to breathe. If the lungs are not breathing, the person will be dying because of the asphyxia, and the asphyxia reason what? Respiratory muscle paralysis. Because they are blocking the glycine at the anterior horn cells. Now plus there will be convulsions also seen. Motor activity you will see. Plus ophiotonous spasm. You will see the hyper extension of the back. The hyper extension of the back is seen. You will see the back will be hyper extended like this. Plus there will be a lock jaw. Hyper extension of the back, lock jaw. These are the features of tetanus, which is mimicking right here. This disease, this strychnine is mimicking the tetanus. Same features you are going to see. In tetanus also, your cause of death will be respiratory muscle paralysis. Here also the cause of death is respiratory muscle paralysis. Respiratory muscle paralysis. Now we are talking about the other finding. This is rhesus sardonicus. That is green-alling phase. Strychnine poisoning person can be presenting you this phase. Muscle contraction is happening. Rhesus sardonicus. Green-alling phase will be there. Green-alling phase will be there. Now treatment, if we talk about the treatment, for the respiratory muscle spasm, the antidote is diazepam. The antidote is what, sir? Diazepam. For the systemic toxicity, the acidification of urine is important. For the systemic toxicity, the acidification of urine is important. This is how you are going to treat the strychnine poisoning, my dear friends. Now, the next type of poisons will be what, sir? Your cardiac poisons. Next would be what, sir? Your cardiac poison. Example is Dawn has queen. Dawn has queen is a very famous name to remember this. Dawn has queen, my dear friends. So remember something, digitalis, oleander, nicotinic, hydrocyanic acid and aconite and quinine. Remember digitalis. Let's talk about digitalis. What is the mechanism of action of digitalis? Mechanism of action of digitalis, it will block the sodium potassium ATPase. Sodium potassium ATPase pump, it will stop. Treatment of digitalis toxicity is digibind. Next is nicotine. Nicotine you see here, sir, tobacco. So you will see one cigarette will have 15 to 20 mg of nicotine. 15 to 20 mg of nicotine will be there. And sign and symptom, if I talk about sign and symptom of nicotine, on heart, it will lead to cardiac arrhythmias. On heart, it will lead to cardiac arrhythmias. Plus, if I talk about the eye, on eye, my dear friends, there will be toxic amblyopia. What do you mean by amblyopia? The word amblyopia means lazy eye. Lazy eye means the coordination between brain and eye is lost. Coordination between brain and eye, the eye will not see. This is toxic amblyopia. Then it is Antidote. Antidote we have inversion. Inversion for the toxicity. For toxicity. Otherwise, to anti-nicotine drug is vernicillin. Vernicillin. So these are some cardiac poisons we have discussed. Now we'll talk about the next, that is aconite. If you see the aconite site here, sir, aconite image is very much clear. It is also known as meetha zahar. The aconite is also called as what, sir? Meetha zahar, and this is odorless. No smell is there of a aconite. And what are the most poisonous? Poisonous are the roots. These are the roots. Roots are most poisonous of the aconite. What is the mechanism of action? If we talk about mechanism of action, it stimulates the sodium gated voltage channel and later blocks. First, it will stimulate the sodium, then there will be a blockage. So what will happen? It causes slow repolarization of the cardiac muscle. Depolarization is happening, but repolarization is very slow. Very slow repolarization can lead towards your bradycardia. So what are the clinical symptoms we have to remember here, sir? The clinical symptom is tingling sensation and numbness. This is called as paresthesia. Tingling sensation and numbness, which is called as paresthesia. Also, there will be a paresthesia of the face you are going to see. The finger, etc. you are going to see. On the limbs, plus on the face also tingling sensation you are going to see of a aconite toxicity. Plus there will be increase in salivation. Meetha zahar, meetha. If we see the meetha, there will be excessive salivation. It's just a mnemonic. Then hippos. What is hippos? Alternate contraction and dilation of the pupil. Hippos means alternate contraction and dilatation of the pupil. Small, big, small, big, big, small, big, small, small, big, small, big. Okay, like this. Alter contraction and dilatation of the pupil. Then bradycardia and tachycardia both can happen. Bradycardia and tachycardia both can happen. Both can happen. Brady and tachy both. Cause of death is ventricular arrhythmia. First there will be bradycardia because it is blocking the sodium gated channel. Then it is stimulating first. Then it is blocking. Now treatment of bradycardia is treated by the atropine. As I told you, atropine is a drug of choice for AV block bradycardia. AV block bradycardia. And tachycardia is treated by amiodarone. Amiodarone is an anti-arrhythmic drug. Anti-arrhythmic drug. Now the next poison what we are going to discuss is oleander. Oleander is of two types. White oleander and yellow oleander. You can see here, this is white oleander and this is yellow oleander. This white oleander, the active principle is oleandrin. And yellow oleander, the active principle would be thevetin or nerifolin. Thank you so much.